As the patient becomes more aware and insightful, he or she is able to look inwards for solution. Through persistence, air pulse autonomic therapy can lead to the ability to control and optimize emotions, urges, instincts, and behaviors, leading to an evolved state of mind. The individual achieves a balance called autonomic balance and a relaxed state of mind and body called the autonomic bliss. And finally, when with the help of my air pulse autonomic therapy, you have achieved a balanced state of mind and body and complete awareness of self and are able to consciously correct negative mental states such as egotism, anger, or the desire for excessive material possessions, you can achieve what I call autonomic enlightenment, a homeostatically balanced and spiritual state of mind, but one that is based on scientific fact. By being non-denominational and open to everyone, person of any faith can participate without feeling intruded upon, violated, or that they have to follow a rigid set of beliefs or practices. It can be done any time of the day, in any relaxed posture, and without any auto-suggestion. The practice of daily air pulse autonomic therapy in combination with walking and jogging, strengthening and stretching exercises, good nutrition, correction of skeletal disproportion, and ergonomics can help the mind and body acquire and retain the necessary agility, which are essential to good health. Such results can be achieved in a very short time, whereas in other types of meditations, it takes forever. My dynamic model for management of pain and stress. Air pulse autonomic therapy has helped thousands of my patients deal with stress, anxiety, panic attacks, and depression. Patients suffering from these conditions can self-administer the therapy at any time or place to achieve lasting therapeutic results. But as a pain specialist, I also work with patients suffering from much more severe problems, such as chronic physical pain. These patients need full range of treatments that I offer at my Washington Pain Management Center. I successfully treat patients with a multimodality approach, of which air pulse autonomic therapy is one part. Patients who have suffered from years of debilitating physical and emotional pain have made astounding progress under my treatment. Even though chronic physical pain is complex and multidimensional, most doctors continue to treat it in a one-dimensional manner, focusing only on part of the problem. When interventions are not coordinated and holistic, when they don't take into consideration the unity of mind and body and the need to treat both simultaneously, such treatments do not bring healing to underlying pathology. When a multidimensional problem is treated in one-dimensional ways by doctors operating in isolation from each other, the cycle of pain and disability not only continues unbroken but also can get worse. Pain sufferers become disabled and depressed, experiencing more pain in the process and becoming dependent or addicted to medication. In my dynamic model, pain patients can take advantage of various options to correct faulty frames of reference imposed on them by unaware professionals. Individuals suffering from chronic pain receive one-on-one quality care that is tailored appropriately to their specific needs. How my multi-modality treatment works, I shall explain to you now. Starting with some of the common modalities I use include, number one, nerve blocks. Nerve blocks are an important part of my multimodality approach to treating pain. A nerve block is an anesthetic. The purpose of the injection is to turn off a pain signal or break the cycle of pain coming from a specific location in the body, or to decrease inflammation in that area. It helps break the pain cycle and provides pain relief. Another important modality which I commonly use is called the trigger point injections. Myofascial pain is the most common type of pain disorder and involves different muscles and the fascia in the body. Trigger points are areas of hyperirritability in the muscle or its fascia responsible for causing pain locally or in the zone of reference. Trigger point injections are a procedure used to deactivate trigger points, those painful knots of the muscles that form when muscles are exposed to repeated stress and strain. Decreased circulation or ischemia results in formation of the trigger points. Injections usually take just a few minutes and several sites may be injected at once. Repeated treatment with trigger point injections can accomplish long-term positive results. Other modalities which I use include facet joint block, sacroiliac joint injections, and others. Facet joints are the joints formed between the two vertebrae in the vertebral column on each side. Arthritis in the facet joint is one of the common causes of neck and lower back pain. Similarly, arthritis of the joint between the sacral and iliac bones of the pelvis can be a common cause of back and hip pain. Blocking or injection of these joints with a local anesthetic solution or in combination with anti-inflammatory injections can provide pain relief.